Hello, this is Dr. Lopez Tan from Legacy Hospice. To highlight Heart Month, I would like to talk about heart health as it relates to hospice and end of life care. It is important to recognize some of the signs and symptoms of end stage heart disease. The conversation about heart disease at the end of life leads to better prepare us for dealing with the symptoms and understanding prognosis. This in turn leads to better decision making towards our goals of care. But first, we must ask the question, what is considered end stage heart disease? A patient with significant heart disease that has significant illness leading to a prognosis and limited life expectancy of 6 months or less is considered to be in end stage heart disease. However, there is difficulty in the fact that predicting the 6 months or less life expectancy is often difficult and can be unpredictable at times. What tools do we have to help us decide? As part of end of life care, hospice and palliative care guidelines are available from Centers of Medicare and Medicaid Services or CMS. However, these remain as only guidelines and are not necessary for a diagnosis of end stage heart disease. In fact, most of the guidelines have not been validated by scientific studies, although they do serve as helpful guidelines for physicians. At least 2 physicians must certify a patient as being appropriate for hospice care based on their clinical experience and opinion regarding the status of their heart disease. So, what does the data say about predicting prognosis in end stage heart disease? More current and updated information that most palliative and hospice care clinicians have a consensus on suggests looking at some of the following factors. Clinical symptoms and signs such as shortness of breath, specifically patients that have episodes of shortness of breath at rest despite treatment with appropriate medical therapy, are generally considered to be in stage 4 heart failure or end stage heart failure. Orthopenia is a significant symptom defined as increased risk shortness of breath when laying down flat and relieved with sitting upright. That also worsens the prognosis of heart disease. Slow or fast heart rates, known as bradycardia or tachycardia, respectively, occur with poorly controlled heart rates and can lead to symptoms related to low blood pressure and increase the risk of sudden cardiac death. Increased edema and body weight are also important findings and are common. Oxygen use or hypoxia suggests significant heart disease. Evidence of poor kidney function, such as a creatinine of greater than 1.4, can lower the prognosis further for a patient with heart disease. Systolic blood pressure less than 100 or a pulse rate of greater than 100 doubles the 1-year mortality. Left ventricular ejection fraction of less than 45% is the new standard as evidence of significant heart disease. Ventricular dysrhythmias increase the risk of sudden death and worsens prognosis significantly. Anemia, noted as each 1 gram per deciliter reduction in hemoglobin, is equal to a 16% increase in mortality for heart disease patients. Hyponatremia, such as a serum sodium less than 136, further worsens the prognosis for a patient. Poor nutritional status also increases mortality. Comorbid conditions such as diabetes, depression, COPD, cirrhosis, stroke, or cancer all can worsen the prognosis of a patient with heart disease. A patient's functional capacity, as measured by the Palliative Performance Scale, is the most powerful predictor of a patient's prognosis. When a patient is mostly bed-bound or even chair-bound, mortality rates increase significantly and provide a better idea of the life expectancy of a patient. Finally, recurrent hospitalizations and ER visits definitely indicate the likelihood of advanced heart disease. Okay, let's summarize some of the key points we talked about. In summary, it is important to recognize someone who has end-stage heart disease, who has a limited life expectancy, since it may help us in planning for meeting the goals of care, including hospice care at the end of life. Clinical symptoms such as shortness of breath, at rest, and increased edema, despite adequate medical therapy, are common. Frequent hospitalizations or doctor visits usually occur, and most patients can also have other major medical illnesses such as diabetes, COPD, or stroke, among many others. That can significantly worsen their prognosis. There are several other clinical factors that we discussed that can worsen a patient's prognosis. Ultimately, two physicians can make a diagnosis of end-stage heart disease based on their clinical decision. Contact your hospice provider to learn more about end-stage heart disease. This is Dr. Lopez Tan from Legacy Hospice. Have a nice day.